Good morning, my lady. Can you see and hear me?
Yep, I can do both now. Thank you.
Thank you very much. We're going to begin this morning with 3 witnesses representing homelessness organisations. I then call Ruth Power, Tim Gutteridge and Nicola McCrudden, please. May they be
the
sworn.
remote witness, I'll start with you. Can you see and hear me?
Yes,
If you'd like to repeat the words after me, please. I do solemnly,
I do solemnly,
sincerely and truly
sincerely and truly
declare and affirm
that
the evidence I shall give
the evidence I shall give
shall be the truth,
will be the truth,
the whole truth,
the whole truth,
and nothing but the truth.
and nothing but the truth.
Thank you.
Thank you.
Yep.
I do solemnly,
I do solemnly,
sincerely,
sincerely,
and truly declare
and
and affirm
affirm
that the evidence I shall give
that the evidence I shall give
shall be the truth,
shall be the
the whole
truth,
truth,
the whole truth,
and nothing but the
and
truth.
nothing but the truth.
I do solemnly,
I do solemnly,
sincerely and truly
declare and affirm
that the evidence I shall give
that the evidence I shall give
shall be the truth,
shall be the
the
truth,
whole truth,
the whole truth,
and nothing but the truth.
and nothing but the truth.
Thank you. Miss Power, may I come to you first, please? Will you give us your full name?
Ruth Power.
Thank you. You should have in front of you, Miss Power, a copy of your witness statement, which bears our reference INQ 000659786. Can you confirm that that is the witness statement that you have provided to the inquiry on behalf of Shelter Cymru for the purposes of Module 10?
It is.
And can you also confirm, please, that any facts stated within the witness statement are true to the best of your knowledge and belief?
They are.
Thank you. Mr. Gutteridge, will you give us your full name, please?
Timothy Paul Gutteridge.
Thank you. You should have in front of you your witness statement, which bears our reference INQ 000651746. Please, can you confirm that that is the witness statement you've provided on behalf of Shelter for this inquiry?
It is.
And that any facts stated within it are true to the best of your knowledge and belief?
They are.
Thank you. Miss McCrudden, will you give us your full name, please?
Nicola McCrudden.
Thank you. You should have in front of you a copy of your witness statement, which bears the reference INQ 000652189. Can you confirm that that is the witness statement you have provided on behalf of Homeless Connect?
It is.
And that any facts stated within it are true to the best of your knowledge and belief?
They are.
Thank you very much. I'm going to begin by providing an overview of each of the organisations that you represent. So, Miss Power, you are Chief Executive of Shelter Cymru, which is the Wales National Housing and Homelessness Charity, offering access to independent advice in every local authority area in Wales. Is that right?
Yes, it is.
Could you tell us a little bit about the work of Shelter Cymru, please, and what it did during the course of the pandemic?
Shelter Cymru's work, as I say, is varied. So we provide services in every local authority in Wales. We operate a court duty service. And our work is all focused on defending the right to a safe home. Alongside our advice and support services, we also undertake research and campaigning and seek to influence policy. We have a key role in advocating for our clients, enabling them to exercise their rights. And we provide those services via a whole variety of means, including online information resources, web chat, a helpline, and in-person advice surgeries and casework. During the course of the pandemic, the shape of those services changed and shifted substantially to remote service delivery. But through the pandemic, we found our services were still just as much needed in terms of providing advice on housing rights and advocacy to enable people to exercise those rights.
Thank you very much. Mr Gutteridge, you are the Chief Operating Officer of Shelter, the national campaign for homeless people, a post that you took up, I think, in April of last year.
I've been the Chief Operating Officer since May 2018.
Ah.
Last year I was the interim Chief Exec for about 6 months.
For a
last year.
period of time. Thank you very much. Shelter's work covers both England and Scotland via Shelter Scotland, but you are giving evidence from mainly an English perspective. Tell us about your organisation, please, and again, what it did during the course of the pandemic.
Sure. So as you say, we work in England and Scotland.
Yes.
We provide sort of legal support and support services to people who are struggling with their housing needs or have issues with inadequate housing. We also try and influence national policy and local government policy and legislation to change to deal with the root causes of homelessness and inadequate housing. And then we also have we also do work behind the scenes to raise the money to fund that work through. We have a retail arm and those sort of things.
And during the pandemic, did the work of Shelter change?
It did. Most of our work went online.
Yes.
Because we provide face-to-face services, and so all of that work needs to go online. Our helpline obviously continued, but that also changed in the way that it approached things.
Thank you. And Miss McCrudden, you are the Chief Executive of Homeless Connect, an organisation that was originally set up in 1983, but under a different name. And it's a representative organisation for the homelessness sector in Northern Ireland, and it has 42 member organisations. Tell us a little more, please, about your organisation and how it worked during the pandemic.
Yes, Homeless Connect is the representative organisation for homelessness services across Northern Ireland. So those services would provide hostel accommodation, street outreach, and also other supported accommodation, floating support services and that kind of thing. And we do policy and advocacy as well. We also operate Fair Share in Northern Ireland that we distribute surplus food across charities and not-for-profits across Northern Ireland, and we continue during the pandemic to do that, distributing over 700 tonnes of food to people. And we also provide essential household items to people who are experiencing homelessness, moving out of homelessness and into their first home, and that continued throughout the pandemic as well. I took up the post as Chief Executive in September 2020, but prior to that, I was invited by the sector to take up the role as COVID liaison officer. And that was really an information sharing role, getting the sector together and making sure that they had the information that was required, liaising with the housing executive, liaising with government departments, making sure people had PPE, that kind of thing. So we also conducted some research as well into staffing situation in the sector and how it was impacted by COVID.
Thank you very much. The inquiry has heard evidence over the course of the last week and indeed yesterday about the impact of the COVID-19 pandemic on housing and homelessness and how it impacted the way people experienced the pandemic in multiple, often intersecting ways. I will ask each of you this morning about those impacts and in particular how those impacts may have varied across the UK, focusing on matters addressed in each of your witness statements. So I'm going to come to you first, please, Mr Gutteridge, to get an overview of the impact of the pandemic on homelessness and begin by looking at the level of homelessness going into the pandemic. So please could we display on the screen INQ 000 621 075. This is a report which your organisation has provided, Mr Gutteridge. It's a report prepared by Shelter entitled Everyone In, Where Are They Now? And it's the need for a roadmap out of street homelessness in England. We can see that it's dated August of 2021. And could we go, please, to page 12 and display and highlight figure 1? Thank you. Could you tell us, please, Mr Gutteridge, what we see here?
Okay, so this shows the graph of the number of people who are street homeless in England, which have been increasing over the previous decade, and there's been a small decline in the year before the pandemic. But it is a snapshot taken in time, It's not an accurate count. It's taken by people going out and counting people who are about to bed down,
Yes.
rather than a specific dedicated number of people. So it's an
Right.
estimate.
Thank you. And you, in explaining what we see in this figure, you have referred to street homelessness because
Yes.
there are lots of different types of homelessness, are there not?
There is. This number doesn't reflect the people who are in temporary accommodation, people who may be sofa surfing,
Yeah.
staying with friends. The number of people who are actually homeless is considerably higher than that.
Yes, thank you. Just before we leave this, is it also right that these figures reflect that the vast majority of those recorded here were men, I think 83%, and that only 14% of women were recorded, but there is evidence that women in particular can be missed because they don't always bed down at night or sleep, and they sleep in hidden places because they are often afraid of gender-based attack.
Yeah, that's correct.
Thank you very much. We can take that down, please. At paragraph 14 in your witness statement, Mr. Gutteridge, you say that homelessness or being at risk of homelessness can have profound effects on anyone at any time. What does being statutorily homeless mean? Does that have a particular phrase? Does that have a particular meaning? We know, for instance, that sections 175 to 177 of the Homelessness Act of 1966 defines it as having no accommodation available to occupy, being at risk of domestic violence or abuse, having accommodation, but it not being reasonable for someone to continue to occupy it. So there are lots of different aspects to it, aren't there, and lots of different reasons why somebody might be homeless.
There are, yes.
If someone is homeless, then are they able to make an application to their local authority for homelessness assistance under Part 7 of the Act?
They are.
And if someone is homeless, eligible for assistance, but not intentionally homeless or in priority need, then are they owed a duty by the local authority pursuant to Section 193 of the Act?
They are owed a duty, but there will be safeguarding put in place or gatekeeping by councils.
Right. And what does gatekeeping mean?
That councils will try and, there is a finite resources available and properties available, and therefore they try and prioritise the people who are presented to them.
So the fact that somebody might be eligible for assistance, might be owed a duty under the Act, doesn't necessarily mean that they will be provided with that assistance, because is it right that often that the need for assistance far outweighs the level of assistance that's capable of being provided by a local authority?
That's absolutely correct.
Right, thank you. I'd like to now display a paragraph from your witness statement, please, Mr. Gutteridge. It's INQ 000651746, page 6, paragraph 17. I'll just read through it. For the following dates, the number of households who were homeless and living in temporary accommodation was, and we have the date and then the number, on the 31st of December of 2019, 88,310 households were homeless. On the 31st of March 2020, 92,180 households were homeless. On the 30th of June of 2022, 95,690 households were homeless. And on the 31st of December 2024, which is the latest data that was available, 127,890 households were homeless. So it's quite obvious that that figure has been rising, and particularly so more recently.
Yeah.
Is it important to note that numbers of households in temporary accommodation are now at an all-time high?
Yes. Yes, I mean, the latest numbers now put the 127,000 at over 130,000. So,
Thank you. Ms McCrudden, do you have a similar pattern reflected in Northern Ireland?
Yes, and that's largely due to the fact that during the COVID pandemic, people who were sharing, people who were hidden homeless, were asked to leave, whether that was through, sharing arrangements, breaking down sharing arrangements, or because of bubbles, etc. But some people would have had the full duty applicant status, as we call it, which is the statutory duty that the housing executive would have. So some of those people would be known to the housing executive, but weren't actually living in temporary accommodation, had made their own arrangements.
Yes.
And there also would have been others who weren't in the system, who were just sharing, sofa surfing, moving around. And as a result of what I just described, more people then presented to the housing executive in need of temporary accommodation. And that situation since then has only gotten worse. So what we're finding is something similar in terms of the English stats, albeit on a smaller scale,
Yes.
given the Northern Ireland population. But yes, a huge increase in the numbers needing and requiring temporary accommodation, which means the housing executive, with the statutory responsibility providing that interim duty even, is having to use more hotels and B&Bs.
Yes, sorry. I should have said we need to watch our pace when we're giving evidence because, of course, the stenographer is taking a full verbatim note. Ms Power, may I come to you, please, now and ask whether your evidence is that similar patterns were seen in Wales?
Yeah, again, elevated homelessness as a result of the pandemic and persistently high levels of homelessness post-pandemic, with far greater numbers of people in temporary accommodation. In the post-pandemic period in Wales, that's been impacted by people who would otherwise be sleeping on the street being included in the priority need category. So with priority need being one of those key gatekeeping tests really that is applied in order to determine who's eligible for what level of assistance. So that has impacted figures in the post-pandemic period. It's a change we welcomed, but it does have an impact on the number of people in temporary accommodation. Yes, stubbornly high would be the phrase that we would use, I suppose, in terms of temporary accommodation and homelessness in post-pandemic period.
Thank you. Remaining with you, Ms Power, if I may, and turning to paragraph 2.1 of your witness statement, may we look, please, at factors increasing the risk of homelessness. You tell us here that the principal factor that increases the likelihood of homelessness is a lack of access to a safe, secure, suitable and genuinely affordable home, and that the structural barriers that mean that can't be offered to every person in Wales are the primary causes of homelessness, and that should always be remembered. You go on to say, at paragraph 2.2, that your casework and research set out the devastating impact that experiencing homelessness has on individuals and families. Is that particularly so with regard to people's health and well-being?
Absolutely, absolutely. There are wide-ranging impacts as a result of homelessness, both during the pandemic and post-pandemic. And while they were heightened in the pandemic, again, these are persistent features of the dysfunction, really, within our housing system.
Thank you. The inquiry has heard of the Everyone In campaign, and we will look at that in a moment. Was there a similar campaign, Ms Power, across Wales called No One Left Out? I think it's described, in fact, as an approach rather than a campaign. Could you describe to us what that was and how it came about, please?
Yeah, the No One Left Out provisions were to ensure that anyone who would otherwise be street homeless was offered temporary accommodation by local authorities so they could be kept safe, and that was regardless of whether they met the priority criteria that applied at that time. That response was largely effective, and we saw local authorities offering temporary accommodation to a far greater number of households than ever before. Although there are some issues that are sort of arising from that we may come on to later.
Yes, thank you. Ms McCrudden, was there any such campaign or provision in Northern Ireland during the pandemic?
There was. Everyone In. Yeah.
Everyone In. So was it the same, or did it reflect the same elements of the campaign in England and Scotland?
Yeah, it did, largely speaking, yeah. And there was the use of hotels and bed and breakfast accommodation for those purposes, as well as other hostel accommodation.
Thank you. Ms McCrudden, I want to just clarify something that is said in your witness statement. You talk about a number of presentations. When you refer to presentations, is that the number of people or households who present themselves to a local authority as homeless or risk of homelessness?
Okay, so in Northern Ireland, we have the Northern Ireland Housing Executive, and it's
Yes.
Northern Ireland wide, so people don't present to local authorities or councils. And we use the word presentations because that means it's a formal presentation or application
Right.
for someone who is homeless. So they would be the number of households.
Thank you. At paragraph 9 of your report, Ms McCrudden, you tell us that when it comes to statistics on homelessness numbers and temporary accommodation during the pandemic, you would make 2 observations. Firstly, the pandemic did have an impact in terms of homelessness presentations, which you've just explained, and acceptances, especially in the initial stages. And you say that between April to September 2020, there was a substantial fall in the number of presentations arising from the loss of private accommodation. Can you tell us about that, please?
Well, at that time, there was an introduction of legislation or regulations, actually, which made that landlords would have to give at least 12 weeks' notice for a tenant to vacate their accommodation before getting a court order. Prior to that, and currently it's 28 days at that time. So essentially, I wouldn't say it was a full moratorium, but it did delay the eviction process. And at that time, prior to that, we were seeing an increase in the number of people becoming homeless because of loss of private rented. So it does show the impact that policy can have in terms of, avoiding risk of homelessness and evictions.
And I think that was also reflected across England, wasn't it, with protected evictions?
Yes, it was.
Yeah. But the second point that you make, Ms McCrudden, in your witness statement, is that as the pandemic measures came to an end, the number of presentations resulting from the loss of private rental accommodation started to rise and rise substantially as inflation rose rapidly. Mm-hmm. So was that the second pattern that you experienced towards the end?
Yes, and that was probably largely due to the fact of rent arrears building up. So if someone had rent arrears, then there was a risk of those rent arrears accruing during that time. And also at that time, landlords were wanting to leave the sector as well. So they were both directly related to this increase in numbers as a result of loss of private rented.
Yes, thank you. And you've already made reference to this, but at paragraph 11 of your statement, you say that one of the impacts of the pandemic on homelessness services was a reduction in capacity arising from the requirements for social distancing. So as people were leaving their own accommodation because I think you mentioned the word bubbles or not being able to safely remain together, that would have increased the capacity of those requiring accommodation. But of course, there are only so many beds and refuges and accommodation types available, are there not?
Yes, and there were still people in the hostels and in the temporary accommodation.
Yes.
It's largely due to the design of the building. So while we would have a lot of self-contained accommodation, we still would have some of the congregate larger hostels, which would have 2 beds a room, sharing facilities such as bathrooms. And because of the social distancing requirements then, that had to end, and rightly so. So that actually reduced the capacity then and the number of bed spaces that some of the hostels were able to provide.
Thank you very much. Could we display, please, the Housing and Homelessness Roundtable report? It's at INQ 000659913. And can we have a look at the impact on access to support services, please? Sorry, my lady, sorry for the pause. My screen's not working. I thought we were waiting for it to be displayed, but of course it was already up. We can see that representatives of organisations who attended the roundtable procedure told of the fact that the pandemic made it harder for homeless people to access some mental health and advice services. For instance, increasing numbers of people in temporary accommodation received inadequate mental health support as staffing levels and available resources could not meet the scale of demand. There was a particularly negative impact on those with mental health conditions and complex needs. Homeless Connect Northern Ireland emphasised that people with more complex needs found the lack of support during the pandemic made their mental health and/or addiction issues worse. For some, this problem has continued. Services provided by homelessness charities and housing advocacy organisations mostly transitioned online, and this created significant barriers for service users. Mind reported that people without phones or internet access were unable to get the support they needed. Many hotels did not provide internet access, which prevented residents from accessing digital support services. However, the shift to digital or telephone support benefited some young people who preferred online help and found it easier to access. And of course, that final point is something that the inquiry heard about yesterday from the Migrants' Right Consortium witness, Miss Humey, who explained that although perhaps older people found it difficult, even those who had access to technology, to work it properly, those who were younger and had more experience in it benefited from online services. Thank you very much. We can take that down, please. Moving to the topic of the Everyone In system then, please, as it was in England and as it ran throughout the pandemic. Mr Gutteridge, coming to you. You say at paragraph 23 that even outside of a pandemic, rough sleeping has significant health consequences for anyone. For example, homeless people are 3 times more likely to have chronic illnesses, which was a risk factor and an increased risk factor during the course of the pandemic. Is that right?
That's correct, yeah.
Yes. And after the pandemic had started, Shelter was concerned that rough sleepers wouldn't be able to follow guidance to stay at home, wouldn't be able to stay hygienic because day centres, which were often used for washing, were closed, and also wouldn't be able to follow the guidance on isolating. And therefore, you tell us at paragraph 25 that Shelter strongly welcomed the fact that the Homelessness Minister, Luke Hall, took what is described as an unprecedented step, writing to all local authorities in England on the 26th of March of 2020 and asking them to urgently procure accommodation for people who are or who are at risk of sleeping rough and those who are in accommodation where it's difficult to isolate. Was there an immediate effect to that decision being taken, and how did that impact upon homeless people in England?
We really welcomed the Everyone In, and it shows what political will and resources can do to try and deal with the problems we were facing at that time. But we know over time there were a number of issues that then came up, that actually it was unclear who everyone was.
Right.
And we were starting to get calls from people who were saying they weren't covered by everyone and were being excluded for a number of reasons by councils. And I think there was some, the lack of guidance at times meant that the interpretation of everyone at a local level was then different in different places.
Right. Let's have a look, please, at the Homelessness and Roundtable report, Housing and Homelessness Roundtable report again, please. And let's go to the Everyone In initiative section. Thank you very much. We can confirm that those who attended the roundtable explained that in England, this initiative involved providing housing to people who were homeless or living in places where they could not socially distance safely. A range of alternative accommodation became available and was used by local authorities as temporary housing, such as budget hotels, bed and breakfasts and holiday lets that were left mostly empty due to restrictions on travel. These properties became available to local authorities as temporary housing solutions, and representatives saw this approach as a good way to provide temporary support to as many homeless people as possible and to access safe accommodation. Representatives commended the Everyone In initiative for adopting a person-centred approach that prioritised individuals' needs over immigration status. They particularly welcomed the government guidance clarifying that immigration circumstances should not prevent access to emergency accommodation. This represented a positive change from the typical approach used when engaging with those with insecure immigration status. Now, we know, just before I read on, we know from the opening submissions that were made on behalf of Shelter that last paragraph that we've just read wasn't entirely accepted by you, was it? Would you like to explain to the inquiry what issue you take with that?
Yeah, I think the issue we have is that it was unclear that it wasn't everyone, and that we certainly had people who were calling us saying because of their immigration status they were being excluded from access to the Everyone In resources. And so I think the data doesn't necessarily show that it was actually about the individual. There were other reasons that then excluded those people, and therefore we're not sure that the data really ties up with that statement.
Thank you. Let's read on, please. There's then a quote from the No Accommodation Network. I think from a migrant homelessness point of view, really needed looking at the person, the need before immigration status. We saw that with Everyone In. We saw positive consequences for individuals knowing what their rights were and knowing their options. So that appears to be describing a slightly better experience than the one that you described, Mr. Gutteridge. And then finally, the Everyone In initiative was thought to have identified people who were not previously known to homelessness services in the UK, described as hidden homeless, which is a phrase that's already been used this morning, including people who were sofa surfing or living in overcrowded conditions. This meant that support could be provided to a wider group of people who had not accessed housing and homelessness services previously. Representatives said that those living in these circumstances were likely to have accessed services through the initiative for the first time because social distancing requirements meant that they could no longer live in shared spaces. So, Ms McCrudden, that appears to be supporting what you have already told us this morning. Is it right that in the experience of Homelessness Connect, that once the Everyone In policy had been adopted and was up and running, there were people who had not before contacted the homelessness charities and organisations who came through and for the first time were able to be helped by them?
Yes, I would completely agree with that. I think the question for me is around the support element of it, because it would be more than a roof over someone's head.
Yes.
You know, I think what was missing from that was the kind of in-reach support and mental health support, which you referred to earlier. That wasn't there, so it was only for a very short period of time. But it was positive that they did come into the system and became known because they were hidden before.
Thank you. And coming to you, please, Ms Power. Does that also chime with the experience in Wales?
Yeah, absolutely. I think hidden homelessness becoming more visible is a key theme of COVID.
Thank you. Moving on to deal, please, with access to emergency accommodation. And coming back to you, please, Mr Gutteridge. Paragraph 28, you say that very quickly during the first lockdown, people from all over the country who were street homeless or at risk of this started contacting Shelter via your hubs and helpline, stating that, as you have explained, they weren't being included in the Everyone In system. We've touched upon already the fact that once the pandemic struck, many services provided by homelessness organisations went online and became digital.
Yep.
What, if anything, was the impact of the loss of face-to-face provision of services?
The obvious impact is that those people who didn't have access to Wi-Fi or internet or didn't own a phone didn't actually have access to the services at all.
Right.
Yeah, and even if lots of them were lots of people in accommodation where there wasn't Wi-Fi, so you know, you had their children couldn't do homeschooling, but actually they couldn't apply for benefits, they couldn't apply for permanent accommodation because all of that had moved online.
Yes.
And that was true of our services as well. We were no longer providing face-to-face support on a one-to-one basis. It was all online during that period.
Yes, thank you. Staying with you, if I may, Mr Gutteridge, but moving on to mortality rates. At paragraph 33 in your witness statement, you tell us about research carried out by the Museum of Homelessness Dying Homeless project, which found that homeless deaths increased during 2020, but that the main cause of death was not directly related to people dying of COVID-19. And you go on to say that their research found that there was an increase in people dying when they came off the streets, and they found that in 2020 there were 976 documented deaths compared to 710 the year before. And it's important to note, you tell us, that more people died from what are sometimes termed as deaths of despair,
Yes.
such as overdoses and self-harm, than they did from COVID-19. So what does that tell us?
I think that tells us that the support services weren't there for people who had complex and support needs. And if they weren't able to access those needs through an online service, that they had no support. And so you sort of see that rise. That would explain some of that rise. But I think some of the issue with this data is that it's unclear that this doesn't align with the ONS data. So I think it's really hard to draw conclusions of this because there are discrepancies in data sets.
Thank you. Ms McCrudden, would you like to add anything from the Northern Ireland perspective about mortality during the pandemic period?
My experience of it was that there was no deaths amongst the homeless population that we were aware of, which is connected directly to COVID. However, what we did see was, increased anxiety.
Yes.
And in some cases, even more use of substances to try and cope and deal with what was happening. So whilst there was no direct, that I'm aware of, deaths related to COVID, I don't have the facts around other deaths of despair, but those could be provided if you would like me to.
Yes, thank you very much. I'm sure that if you could provide that data, it will be well received by the inquiry. Thank you for that offer. And Ms Power, coming to you, please. Is there anything that you would like to add from the Welsh perspective about mortality rates during the COVID pandemic?
Similarly, I don't have data from Wales that I can share with you, but the point that was just made by Nicola in relation to the undoubted impact on well-being, on people's mental well-being in particular, is strongly recognised.
Thank you very much. Next, the impact of pandemic eviction prevention measures, which we've already made mention of. And coming back to you, please, Mr Gutteridge, at paragraph 64 of your witness statement, you say that during the pandemic, the government banned all evictions for tenants and home occupiers from March 2020 to the 31st of May 2021. That ensured that during that period, people were prevented from losing their homes and becoming homeless, which was a move, again, that Shelter welcomed. You then give some statistics. You say that in the second quarter of 2020, landlord possession claims were down 89% compared to the same quarter the year before. Were there, nevertheless, difficulties experienced with the the prevention measures? Did they apply across the board to everybody? And is there anything that you would like to add about what happened when those measures were lifted?
I don't have evidence to say whether it applied to everybody or not to hand, so we can dig into that and provide that for you. I think we absolutely welcomed it at Shelter. There was a risk that it was delaying the inevitable, and we would see all of those evictions just pushed down the line. We have seen evictions grow, but they haven't grown to pre-pandemic levels yet.
Yes, thank you. At paragraph 67, you say that the government also temporarily banned evictions from asylum accommodation in March 2020 for people who had been refused asylum in the UK, and that the British Red Cross estimated at the time that about 50,000 people were spared the threat of losing their accommodation as a result of that provision coming into force. Is that right?
That's correct.
Right. Coming to you, please, Ms McCrudden. You've already mentioned pandemic eviction notices and prevention measures in Northern Ireland. Were you seeing a similar pattern once those measures were lifted towards the end of the pandemic?
Yes, we were. We did see that, yeah. We did see increases in numbers again, particularly from loss of private rented, as previously stated.
Thank you. And coming to you, Ms Power, again, was the pattern similar across Wales?
Yeah, in some ways, I think there's quite strong features, though, in Wales. Looking at the MOJ data from the pre-pandemic period and looking into, say, 2022, what it shows is how important tenure is. So the fluctuations in social landlords' possessions, saw a very dramatic fall, as you would anticipate, in the COVID period. But as a result of Welsh Government and social landlords agreeing the broad moratorium on evictions, they've not returned to anything approaching the pre-pandemic levels. So there's been a real shift in practice and culture around possessions from social landlords in Wales. Whereas for private landlords, repossessions, we had the halt that reflected these sort of cold closures. But by Q3 of 2021, those private possessions were back to similar levels to the pre-pandemic period, and our private rented sector casework related to possession actions didn't significantly change at sort of outside of the court closure period. So for us, that reflected that there were less protections for people in less secure homes, and that short-term benefit to private sector tenants really of the measures that were put in place. The levers that are available to government in relation to social landlords were not available in relation to the private rented sector.
Thank you. The inquiry has heard evidence about the impact of overcrowding in households during the pandemic, and in particular the impact of overcrowded households in deprived areas from Professor Nasru. I'd like to turn to the topic of overcrowding and density now, please. And could we look at the roundtable report for housing and homelessness and go to page 14, please? Because the roundtable were told that the pandemic meant that people were spending more time at home, sometimes in overcrowded conditions, particularly for people living in shared houses and houses of multiple occupancy. Representatives said that disproportionately affected people from lower social economic backgrounds, as they were more likely to be living in poorer housing quality. St Mungo's referred to overcrowding disproportionately affecting people from some ethnic backgrounds. For example, they said 2% of white British households were overcrowded, compared to 25% of Arab households. And there is then a quote from St Mungo's. I think people's experience of lockdown was based on the quality of their housing and the amount of space they had, particularly for people who were poorer, people who had been in temporary accommodation before the pandemic. It's about 6 foot by 10 foot room you're in, maybe with a shared bathroom. Thank you very much. So the circumstances of people's housing, the quality of their housing, that would have had a direct impact on the sort of pandemic experience that they had. Is that right, Mr. Gutteridge?
That's absolutely right. You know, if you're in cramped, if you've got shared kitchen facilities or shared bathroom facilities, actually you're sharing with people not necessarily in your family, and therefore the risk of transmission would have been higher. And you know, the fact that you're all stuck in that building permanently,
Yes.
you know, during lockdown meant that actually the risk of transmission, you know, the risk of damp, etc., would have increased because of being locked into those facilities.
Thank you. Well, we're going to come on and to look at the state of the physical state of the properties briefly in a moment. But is it right that overcrowding, as well as the circumstances in which we've just looked at in the report, tended to be or tends to be more prevalent in the rented sector than for owners?
It does. So the government data shows that there's an average of around 3% of houses are overcrowded, but that absolutely skews towards the social housing, where it's around 8% of households, and private rented sector that's around 5% of households. And when you compare that to sort of homeowners, that's only 1%. So it's very much skewed towards the rented sector.
Thank you. Could we go back to the Roundtable report and look at page 13, please, and highlight the first two paragraphs? Come back to the point which you were just making, Mr. Gutteridge, about the physical state of the housing. The quality of housing was said at the Roundtable to have decreased during the pandemic because some repairs or maintenance operators temporarily closed or scaled back their maintenance services. This meant some people were living with serious problems such as no hot water or damp, as you've mentioned, or mouldy conditions for long periods. This had a negative impact on their physical and mental health. Social housing providers with in-house maintenance teams were able to resume repairs once pandemic restrictions allowed them into properties again. However, those who relied on external maintenance contractors found that many had shut down or furloughed staff, which meant residents had to live with problems for longer. Shelter said that private landlords reported similar challenges in availability of workers to carry out repairs. They noted that private rental properties were often in a worse state of repair than social housing properties because landlords can be less responsive and there is often insufficient investment in property maintenance. And they said this worsened during the pandemic as some landlords used COVID-19 as an excuse to avoid conducting necessary repairs.
Yeah, that's correct.
At the end of that first paragraph, this had a negative impact on their physical and mental health. Is that right, that not only is the poor state of rented housing mainly, and it can be a cause of physical poor health,
yes,
because of the effects of damp, but also experienced over a long period of time, would necessarily have an impact sometimes on the householder's mental health?
That's absolutely correct. We did research with families during the pandemic to understand some of the issues that they were facing, and certainly we had families who were reporting that they were unable to, actually cook food in the same way because they didn't actually have kitchen provisions, and therefore people were reporting that they were losing weight. And families were also reporting they had additional mental health issues because of being the lockdown. We then followed that up with a further report in 2023 where we actually said much bigger research, which shows that significant numbers of people were reporting that actually their physical health was impacted directly by the temporary accommodation they were in, and their mental health was impacted. And I think the key point that we take from that at Shelter is that actually temporary accommodation isn't good for people's mental health and physical health anyway.
Right.
You add on to that the impact of the pandemic at the same time, and it just multiplied that impact up.
Yes. Is that something which you saw as well, Miss McCrudden, in Northern Ireland?
Yes, indeed. If people are spending longer amounts of time living in cramped, overcrowded, poor housing conditions, certainly, it will impact on their mental health. So, yeah.
Thank you. And coming to you, please, Ms Power, you deal with this at paragraph 4.2 in your statement. You tell us that damp and disrepair were an area of growing concern in Shelter Cymru's casework during the pandemic and since. And you say that in 2019, so going into the pandemic, around 6% of your casework was related to damp and disrepair, which hit a high of 15%, so more than doubling by late 2023. Is that right?
Yes, it is.
Yes. You go on to say at paragraph 4.3, the backlog of repair work has taken a long time to dissipate, and your recent casework trends suggest that you have still not significantly worked through that backlog. Is that right?
Yeah, that's correct.
Thank you. I'd like now to look at the impact of the pandemic on housing availability and primarily housing affordability. Could we have a look, please, at a document called Better Housing Briefing, which is a report from the Health Foundation. We can see that it was published in December of 2020. And if we could look, please, at the first two paragraphs at page 13, please, which should deal with housing affordability. Thank you very much. Housing affordability can affect people's mental health directly, as well as reducing the resources available to them to spend on other goods and services. Struggling to meet housing costs can lead to rent or mortgage arrears, which can lead to eviction or repossession. However, affordability can be difficult to measure. If someone spends a high proportion of their income on housing costs, this could be a discretionary choice to gain better housing, but equally, it could represent an involuntary burden. Nonetheless, in the UK, there is some evidence of a link between problems paying for housing and the ratio between housing cost and income. Thank you. Ms Power, at paragraph 6.1 of your statement, you say that during the pandemic there were difficulties for people in finding and securing new homes across all tenure types, and that lockdown periods and restriction of movement created additional challenges in completing the practical steps of this process, as well as arranging complementary services such as removals. And in terms of finances then, did you find in Wales that as people were, particularly those who were working in industries where they could no longer work either at the same rate or indeed at all in the manner in which they'd been working pre-pandemic, that money became tight, that housing costs remained the same, and that people began to feel that they could no longer afford to pay for ordinary living expenses as well as their rent or mortgage that they were commissioned to do.
That certainly risks the income that people experienced during the pandemic would have a knock-on effect in terms of the precarity of housing, which not only impacts housing stability for the household, but also impacts mental well-being very significantly.
Yes, and you tell us at paragraph 6.7 of your report that your conversations with landlords has led you to believe that there were rises in mortgage rates, with landlords then passing on those costs to tenants, and how that had impacted the market and had really gone on to normalise high rents. You say that you're not an economist, but you feel that you wouldn't be able to speculate on the links between the COVID-19 pandemic and inflation and the costs of living crisis and increased mortgage rates. But nevertheless, what you found was that costs rose and income didn't rise at the same level.
The rise in private rents in Wales, which have been quite dramatic in recent years, but that pattern starts in 2023, as the ONS data sets out. So that's a slightly later pattern, but there is that strong link between, the precarity of income and the precarity of housing.
Yes, thank you very much. Ms McCrudden, I'd like to come to you, please, and invite you to look at paragraph 17 of your report, where you summarise the impact of the pandemic on the homelessness sector so far as Northern Ireland is concerned. And you tell us that the COVID pandemic had wide-ranging consequences for the homelessness sector in Northern Ireland. And you say it's safe to say that, like most other services in this society, while contingency planning for emergencies had often been produced by services, no service was prepared for the specific impacts wrought by COVID-19. And you say that services which were already struggling with recruitment and retention issues when it came to staff had to adapt quickly to the rapidly changing terrain related to the pandemic. You say that you're proud of how the homelessness sector and staff in Northern Ireland responded to the pandemic and of the role that Homeless Connect played in supporting the sector. But does that highlight that the pressure upon those who were working within the sector, trying to pivot to new rules being implemented by the government and an increase in people needing their services?
I do. I would say that at the very early stages there was almost confusion because of the guidance that was not available at the time. I referred before to the homeless sector almost being the forgotten sector because it's not part of the health service, it's not part of the residential care service. But what was really positive from that was it was a health official placed in a regional coordination role. So the communication then between the homelessness sector and health professionals became really important for us. And once we got access to that, it almost opened doors. But yes, indeed, we did have to pivot very quickly and adapt very quickly. And the main concern, and I'm very proud of our sector and the staff that work in our sector, is for the people that they work with, the people who are experiencing homelessness. And if you can't provide that support and you have to social distance and wear PPE, it creates barriers between our staff and the people that they serve. So it was extremely difficult. People had to change their shift patterns, longer shifts, working in isolation, lone working, all those really good principles that we have in terms of trauma-informed practice and care almost had to be set aside. And thankfully, that's not the case now. We've gone back to our ways of working before, but it's really that the sector was already under a lot of pressure and strain in terms of recruitment and retention, and we're still in that situation now. In fact, I would say it's much more difficult to retain and staff in the sector, and some of that is potentially from the legacy of dealing with COVID.
Thank you. Mr Gutteridge, I could see you nodding along to Ms McCrudden's evidence there. A similar picture, I presume, from Shelter and the people who were working and keeping the system going.
Yeah, absolutely. I'm immensely proud of the change that our staff went through very rapidly. We pivoted to online services really quickly. We changed our behaviour and the ways of working. Like my colleagues on the panel, we all worked immensely hard in very difficult circumstances to ensure the people that we're here to serve were served as best as they could.
Thank you very much. Ms Power, coming to you, please. Did you see a similar situation being experienced by the people who were working for Shelter Cymru and keeping that service going throughout the pandemic?
Yeah, I definitely recognise the feeling of pivoting very quickly. I think the pride in the workforce, but also the impact on the workforce can't be underestimated. And I think that the fact that COVID was followed very quickly by the cost of living crisis meant that there was no breathing space really for anybody, whether in the third or the statutory part of the sector. So the demands have been continuous, and that is a very heavy demand on a workforce that had really stood up so well during the course of the pandemic.
Thank you. Just remaining with you, Ms Power, if I may, for you to explain to us what has been described as the legacy of No One Left Out in Wales. At paragraph 8.1 in your statement, you tell us that the Welsh Government have cemented their continued commitment to this wider access to temporary accommodation by introducing a new priority need category. Can you tell us about that, please?
Yeah, so following the no one left out measures, there was a steep fall in any case after that in local authorities applying the priority need test in the post-COVID period. And Welsh Government then built on that suspension of the priority need category by extending the categories in Wales to cover people who would be otherwise street homeless. They became a distinct category of priority need. So we've seen a shift towards a more universal system, more universal help for people experiencing homelessness. Having said that, the housing and homelessness system hasn't fully adjusted to respond to that yet. And we've published reports. One of our Waiting for a Home is one of the reports we've published, highlighting really the scale of demand for social homes in Wales that is inhibiting the flow through temporary accommodation. So we have really welcomed those changes, and the government has built further on that. So in February has passed the Homelessness and Social Housing Allocations Bill, and that will, in the future, see an end to priority need in Wales. So there's been a consolidation of that shift to more universal help, albeit that there's still considerable issues to work through in the short and the long term to make sure that we can provide everybody with a suitable home.
Thank you. And finally, please, Ms Power, what are the lessons learned that you and your organisation have taken from the pandemic, and what are the recommendations that you would like to make on behalf of Shelter Cymru that could be considered going forwards to ensure that that things are better for those who experience homelessness during the next civil emergency?
I certainly think that the point that the pandemic showed what is possible to achieve in terms of homelessness with political leadership and additional resource and strong collaboration, I think was an outstanding demonstration of what we can and should achieve in terms of ending homelessness. The collaboration and the communications in Wales between Welsh Government and stakeholders were very strong, and there was a real sense of working in partnership through a crisis. I think there is learning in terms of service adaptation and learning. So in terms of the shift to remote service, we previously provided only 5% of our services remotely. We're now much more of a 50-50 split between remote and in-person services, and that reflects positive feedback from people in rural communities, families who are trying to deal with their housing needs, with juggling family commitments, people with physical and mental health issues, disabled people who've really welcomed that changed way of working. So I think it demonstrated that could be achieved quickly, and that there were real benefits in doing that. I think the key point, though, that we would come back to is that in Wales, we were vulnerable entering the pandemic in terms of our housing system. The system was already under strain because of decades of underinvestment. So whilst it stood up quickly, it did that from a low base. And what that meant was it wasn't perhaps as person-centred and nuanced and able to deal with the most vulnerable as it might have been had it been in a stronger position. So we would very much want to see a strengthening of the foundations of the housing system, a strengthening of the foundations of the welfare system, and that approach to homelessness that are fit for purpose and are centred around helping everybody universally to get access to that sort of fundamental of home and to deal with the precarity and poor quality that we have in some of the homes that people were confined to during the pandemic. So our calls are for more social homes, for stronger regulation of the private rented sector, and for addressing those shortcomings in the welfare system that directly contribute to people's housing precarity and to homelessness. So strengthening the foundation, strengthening the resilience of the system would give us more resilient housing system, more resilient communities, and more resilience for individuals through an incident like the pandemic.
Thank you. Ms McCrudden, the same question to you, please. What are the lessons learned on behalf of Homeless Connect?
Well, I concur with a lot of what Ruth has said. I think what struck me really is the importance of home to everybody in this room and across society, and the importance of having a home that is safe, that is secure, that is affordable, that is of good quality. And we don't have enough homes, so prioritising affordable social housing provision is definitely top for us. But also what struck me was the deep connections which we already knew between health and homelessness.
Yes.
And during the pandemic, what we see was a lot of silo working and being broken down, a lot of can-do attitude and people pulling together in the right direction. Some of that still exists, but to a larger extent it hasn't. So people have maybe gone back into the ways of working that they've done, the pattern of working that they had before. So we would very much like to see a bridge and a connection between health and homelessness at a very strategic high level. We think that's vitally important. If there was a pandemic or anything of this scale to happen again, it shouldn't be our sector to respond first and to ask for help. Those systems and the governance mechanisms need to be there, and we need to be starting now and not waiting until the emergency crisis situation. So my third ask would be, again, what Ruth was saying about resilience within the sector and the underfunding of the sector. So our sector, in terms of the homelessness staff in the homelessness sector, was already facing difficulties. There were resilience issues there, and to all their credit, they did stand up to the mark. But if anything again was to happen, I would be very concerned about how the sector would be able to respond, and that largely comes down to funding and support from government.
Thank you very much. And finally, Mr Gutteridge, the same question to you.
Yeah, sure. I completely agree with what my colleagues have said. I think, yeah, and I'm not going to repeat the same things because it's very much around the resilience of actually the housing that is available for us.
Yes.
And I think if we're going to face a future pandemic at some point, we need a better housing system that enables us to provide homes to those people. And ultimately, what the country needs is to invest in social homes so we have safe, affordable homes that people can be put into, whether they are on the streets or in temporary accommodation, so that actually we are not repeating everyone in was great, but there were challenges with it. And so actually we need to take a decision as a country to actually solve the fundamental problem, which is the lack of social homes, because that will help unlock a lot of the challenges that we all faced during the pandemic and in the cost of living crisis afterwards.
Thank you very much. My lady, that concludes my questions. I know that you have provided permission for one question to be asked by Migrants' Rights Consortium and one question to be asked by the Domestic Abuse Group. Migrant Rights Consortium's question is going to be asked, I understand, by Ms Iqbal.
Thank you. Ms Iqbal, please.
Thank you, my lady. Mr Gutteridge, you discussed the limited success of the government's schemes to reduce homelessness during the pandemic in your witness statement, and you touched on this earlier during your witness evidence. The Migrants' Rights Consortium's evidence is that these measures often did not mitigate the adverse impact of the pandemic for many migrants because this group were often excluded or otherwise less able to benefit from the migration measures due to immigration law and policy which excluded them from essential services, including the mainstream welfare system. So you indicated earlier in your evidence that this was consistent with your view. So could this adverse impact have been mitigated in any way?
Can you just repeat the last sentence of what you said? I didn't quite catch the last sentence.
Of course. You indicated earlier in your evidence that this was consistent with your view when questioned by counsel to the inquiry. So could this adverse impact have been mitigated in any way?
I think the best way to have mitigated them was to actually have clear guidance that when everyone in was being rolled out, actually being clear that that meant everyone. The lack of guidance meant that the interpretation of that programme of work was left to local councils and providers, and therefore they were making decisions at that point based on their own interpretation of the law. And so I think that had we had better guidance, we'd have had a more consistent approach rollout, which would have meant that those people with no recourse to public funds wouldn't have been excluded in the way that we saw in various locations.
Thank you. I'm grateful, my lady.
Very much, Ms Iqbal. Ms Monk.
Thank you, my lady. Can everybody see and hear me? I'm seeing nods. My name's Angharad Monk. I appear on behalf of the Domestic Abuse Group. I have one question which I will direct to Mr Gutteridge, but any views from the panel would be most welcome. The question relates to issues of suitability which specifically affected women and survivors of domestic abuse during the pandemic. The Domestic Abuse Group have observed that placements were often of a kind unsuitable for victim survivors, with refuges full and limited same-sex placements available. Women survivors seeking homelessness assistance from councils were often placed in unsuitable temporary accommodation, including mixed-sex hostels, where women and children had to share spaces with adult men, as well as bed and breakfast with poor facilities and overcrowded conditions that made social distancing impossible and increased the risk of infection. Do you agree that the lack of same-sex placements for women fleeing abuse means that they are offered unsuitable accommodation?
I completely agree with that, yes.
Thank you. And are there any other views from the panel?
Yes, would agree with that, and also say more broadly, not only for women fleeing abuse, but the lack of same-sex accommodation is problematic in itself, particularly for women fleeing abuse.
Yes, and I would concur with that.
Thank you very much. That's my question, my lady.
Thank you very much, Ms Mark. Very grateful. Thank you very much, Mr Guttridge, Ms Crudden and Ms Power. Very grateful for obviously the work that you and your colleagues did to try and help your constituents during the pandemic, but also for the help you've given to the inquiry. And if you feel you haven't mentioned something today, don't worry. I promise you I do take into account the written evidence as well as the what you said here today. I say here, I'm not with you, but anyway, what you said in Dornan House. Ms Power, wherever you are. So thank you all very much indeed.
Thank you, my lady. Is that a convenient moment for us to take our break?
It is. I shall return, as you've made good time this morning, at 11:30.
Thank you very much.
Ms Blackwell.
My lady, I can hear you, but I can't see you. Can you see and hear me?
I can.
There you are. I can now see you on my side screen, but not on the big screen. I'll just pause to see whether that can be rectified, my lady, because it's important that... there you are. Thank you very much. My lady, may I call the next witness, please? Peter Matichik.
I do solemnly,
Sincerely and truly, declare and affirm
that the evidence I shall give
shall be the truth,
the whole truth,
and nothing but the truth.
Thank you.
Will you give us your full name, please?
Yes, my name is Peter Andrea Matichuk.
Thank you very much, Mr. Matichik. You should have before you a copy of your witness statement, which bears our reference INQ 000659871. Please, can you confirm that that is the statement that you have provided to the inquiry on behalf of the Joseph Rowntree Foundation?
Yes, I can confirm that.
Thank you. And that any facts stated within it are true to the best of your knowledge and belief.
Yes, they
Thank
are
you
true
very
to the
much.
best of my knowledge.
Thank you. The Joseph Rowntree Foundation is an independent social change organisation working to support and, as you say in paragraph 1 of your statement, speed up the transition to a more equitable and just future, one that's free from poverty, where people and the planet can flourish.
That's right.
Is that right? And is it active under all 4 nations of the UK?
It is, yes.
Thank you very much. Is one of the overarching aims of the Joseph Rowntree Foundation during the period of the pandemic, was it to provide research, policy, collaboration and practical solutions to inspire action and change?
Yes, that's correct.
And during the pandemic, were there 3 roles undertaken by the Foundation? First, as a funder and an amplifier of the voices of people who experience poverty.
Yes.
Second, as a source of solutions, and by that I mean that you advised on practical solutions that you thought the government and employers should adopt.
Yes.
And third, did you bring what's described as a strong voice to hold governments and others to account for how their actions should meet your collective obligation to protect people on low incomes from bearing the brunt of
Yes,
the
we
pandemic?
certainly did.
Thank you. I'd like to begin, please, by looking at the Joseph Rowntree Foundation's definition of poverty. You set that out at paragraph 5 in your statement. Can you tell us what that is, please?
Yeah, so basically it's when a person's resources, so mainly their financial resources, are insufficient to meet their needs, and that includes social participation. So it's not just financial, but it includes being able to participate in society. And we normally measure that through low income, but we also look across the range of different indicators to try and get a big breast picture as possible.
And what are those indicators?
Yeah, so we look at, so our main measure is someone being below 60% of the median income, so it's something called relative poverty.
Is that 60%, did you say?
It is 60%.
Could I just ask you to slow down your delivery a little bit?
Of course.
Thank you. Yes.
Yeah, so that's our relative low income measure, and it's normally measured after housing costs, so after deduction of housing costs, because obviously housing costs are an essential cost. But we also look at other indicators like food insecurity, people going without essentials and things like that, just to kind of cross-tabulate that indicator to make sure what it's telling us, we're getting a full picture and understand what's really going on.
Thank you. Could we display, please, your witness statement? It's at INQ 000659871 and highlight the table. Thank you very much. What does this show us, Mr. Matichik?
Yeah, so this is our headline poverty measure, and it shows the poverty rate over time, so since the start of the data that we've got, which is the mid-1990s.
Yes.
And it shows basically, if you look at the top line, that children have always had the highest rate of poverty.
Yes.
We've had quite good progress in tackling pensioner poverty over the period, but basically that we see pretty small, limited progress over the last sort of 20-odd years, with poverty being fairly flat. And one other thing I wanted to mention at this point is that even though it looks quite flat on this picture, we've seen deepening poverty, so more and more people being far away from that poverty line. So almost half of people in poverty in the latest data were in very deep poverty, far away from the poverty line, and that's a record level.
Right, so even if somebody qualifies to be described as being in poverty, there are levels of poverty, and what you're describing is deep poverty, and more people falling into that description.
That's exactly right.
Thank you. Yes, thank you very much. So this shows us, if we look at the right-hand side of the table, how things were going into the pandemic.
That's right. And it's interesting to see that you'll see a dip in the pandemic year of 2020, 2021.
Yes.
And that's partly because of some of the support that the government put in place, including on the benefit system, but also a consequence of that relative poverty measure, because it's a gap between poor people's incomes and the middle income people, and that gap shrunk because both some of the measures brought people's incomes up, but also the average incomes in the population also fell a little bit.
Right, thank you very much. We can take that down. I'd like to ask you about the impact of the pandemic on mental health and well-being of the population, and we will look at 3 areas. The first, the impact of pre-existing mental health issues for people on low incomes. You tell us at paragraph 16 that your qualitative and quantitative work shows that the pandemic magnified pre-existing mental health issues for people on low incomes. How did that happen?
Yeah, so basically people with low incomes have got like existing susceptibilities, so they might be in insecure work, might not actually be reliant on the benefit system and not be working, might also already be struggling to afford food, travel, all the essentials that we take for granted. And basically all of those things combine to worsen a person's mental health. That kind of stress of living in a low income is a trauma in itself, and the stigma of being on low income. And basically that was before the pandemic hit.
Yes.
Quite a lot of those things would have been worsened actually by the pandemic, plus the kind of stress of it as well. And so that's why sort of those existing susceptibilities, almost it was the pandemic would have played straight onto those and made it a lot worse for those people who are already suffering disadvantages.
Thank you.
I'm afraid the dog for struggling.
I'm
I'm sorry.
We need to slow down,
Yes,
please.
I'm sorry about that.
I should have kept an ear on the speed at which you were talking, so it's entirely my fault. And you go on to describe that financial shocks during the pandemic, so people who lost their jobs or had their hours significantly reduced, extra costs that came as a result of the pandemic, food, heating, digital access, loss of informal support, and housing or food insecurity naturally produce higher levels of stress and depressive feelings. And shame as well is something that you include as well.
Yes, we see the stigma of being in poverty and that kind of shame of having to ask for support. And obviously during the pandemic, new people would need that support for the first time.
Yes.
But also that kind of existing levels of support are quite hard to access as well at that point.
Thank you. Key factors of deteriorating mental health and differential aspects across different phases of the pandemic is something which we haven't looked at before. Can you take us through, please, from the early pandemic through the medium term and then towards the end, and tell us how those influences might have changed?
Yes, of course. So in my evidence, I set out 3 phases of the pandemic in our assessment. So in the early phase of the pandemic, which we've taken in this analysis from being from March to summer 2020, there was a sudden income loss for many, many people, as either through losing the job at all or losing hours of work. There was also a lot of uncertainty about benefits, about what you would be able to access and how you'd be able to do so. There was also an inability to access shops or support. And then, obviously, across the whole of the population, there was a fear of actually catching COVID.
Yes.
And what we saw throughout our evidence is just that fear. So fear of parents about where their children, taking them to school or bringing that virus home.
Yes.
Or to vulnerable relations. Increased daily costs for shopping, lack of routines as people's lives were, they're used to routines were just totally disrupted.
Yes.
And we feel that there was a disproportionate effect on this group just because of those vulnerabilities I've already mentioned. So that was that sudden impact.
So that was at the
That's
beginning.
That's right at the start, yes.
And then how, if at all, did things change in the medium term? So going towards the end of 2020.
Yeah, that's right. So our medium term is sort of summer to autumn 2020, and it's that kind of sustained chronic stress that we pick up then. So obviously you've started with this kind of very shocking start of the process, but then it's going on, and those kind of susceptibilities are building up over time. And then there's also the uncertainty about, well, what's going to happen, how temporary are some of the temporary measures.
Yes.
What's going to happen to your work, what's going to happen to your benefits, because at this point there were lots of schemes that were put in place, but it was uncertain the duration of them.
Yes.
And the kind of reliability of them. So that kind of chronic stress was what we picked up at that point.
And then moving to what you describe as the later stages, so late 2020 and going into and coming towards the end of 2021, what did you see?
Yeah,
then?
so basically that kind of compounding and accumulating harms. So those things that have happened to date, that before that point, they're still in the system, and at that point, some of those supports are actually being withdrawn.
Right.
So some of the problems that have been maybe mitigated but haven't been solved, once an element of support gets taken away, so for instance the £20 uplift to benefits or the eviction ban, basically quite often the problems that it's kind of disguised just rear their heads at that point. And I think also there's just that kind of accumulation of stress and so forth. So I feel that we are still seeing some of we are definitely still seeing impacts of the pandemic in even the latest statistics. So, it's got a very long tail to those impacts just because of the duration and the severity of them.
And you say at paragraph 21 that sustained insecurity, which is what you describe, is associated with higher prevalence of poor mental health and a vicious cycle where poor mental health makes it harder to escape poverty.
Yeah, that's exactly right, and that's what we see in the data, is that there is a clear downward trajectory in terms of the lower your income, the more likely you are to suffer mental health issues, and therefore that kind of cycle then becomes a vicious circle of that then driving you into poverty, that then worsens your mental health, etc., etc.
Thank you. In terms of looking at who was disproportionately affected, please could we display at page 9, paragraph 25 of your witness statement? Thank you very much. And you set out here clear disparities, is how you describe it, in who experienced the worst mental health outcomes. We can see listed there lone parents, households in very deep poverty or destitution, people in deprived areas, people from some ethnic minority groups. In particular, you saw greater impacts for some ethnic groups. People from Pakistan, Bangladesh, and with black backgrounds experienced worse mental health prior to the pandemic. And was that also seen during the pandemic as well?
Yes, that's right.
Yes. And migrants, disabled people and unpaid carers, and private renters, mortgage holders facing arrears or eviction risk, people with complex needs, as defined in your destitution study, which includes homelessness, drug and or alcohol problems, domestic violence, or involvement in begging or the criminal justice system. And finally, those who were digitally excluded. And of course, some people would fit into more than one of those categories, wouldn't they?
Yes, no, indeed. There's that kind of intersectionality, I think, is something that's really important for people to understand in terms of policy implications, that you don't fit into just one of those. Particularly if you're very susceptible to these issues, you may be in multiple categories, and that can exacerbate your experiences.
Thank you. Do you agree that being in poverty can affect a victim survivor's ability to flee from it? For example, those without housing or financial security may find doing so far more difficult than those not in poverty.
Yes, that's correct. And I think there's also the case of the kind of unsuitable accommodation as well, where basically you're stuck in that unsuitable accommodation, and also the support systems that you might rely on in those circumstances are harder to access. So yes, you're exactly right.
Thank you. So you would agree that being in poverty can also affect a victim survivor's access to support. People needing legal support, for example, may not be able to easily access it without the funds to do so.
Yeah. So, and I think there's a series of barriers. So from, as you say, income, but also just knowing how to get to that support. So quite a lot of the people we're speaking to were used to actually going to a face-to-face visit, and some of them actually needed that kind of support.
Yes.
And almost their second preference was on the telephone, but quite a lot of the support was just online, which is a lot more impersonal and maybe not what they were used to accessing previously.
Yes. So it was a positive reaction to allow the service to continue online, but it was often a substandard service for many.
Yeah, and I think partly almost it was inevitable in that people have got certain expectations and needs, and that those can't be met online in all instances.
Thank you. Turning to look at drivers of poor mental health, you deal with this at paragraph 27, and you list the following: income shocks and instability, inability to afford essentials, loss of informal support networks and enforced isolation during the pandemic, digital exclusion, and also service disruption, which you've just mentioned, moving to remote services. You then go on at paragraph 28 to say this, that our reports and briefings describe shame and long-term stigma as traumatising and long-lasting, and describe the emotional impact of bereavement and community loss where COVID hit deprived areas particularly hard. Food insecurity and the stigma of needing help is linked to shame, loss of dignity, and social withdrawal that are all clear drivers of anxiety and depression. And your poverty stigma is a glue that holds poverty in place. Briefing calls stigma traumatising and long-lasting. What do you mean by that?
Yeah, so what we see is, so this report was written in collaboration with people with lived experience of poverty.
Slow down.
Yeah, it was written in collaboration with people with lived experience of poverty.
Thank you.
And yeah, that is what they described, that it was traumatising and long-lasting. And they went through the different services that they were having to access and how they felt they were treated. And I think sometimes it was actually those services that were sometimes doing the stigmatising. So I think there is some improvements there that can make those services better to access for people who are very vulnerable at the point when they're needing that help.
Yes, thank you. Let's look, please, at an article which you have provided to us and for which we are grateful, that's called Staying Afloat in a Crisis, Families on Low Incomes in the Pandemic. Thank you very much. We can see that it's something which has been written certainly in conjunction with your organisation by Catherine Hill and Ruth Webber. And it's a report providing a unique insight into the lives of 14 low-income families, exploring how they coped with the first 6 months of the coronavirus storm. And it shows that we need to take further action to provide the security that parents need when bringing up their families in an unstable world. It's dated March 2021. And if we can look, please, at page 31, we can see that it deals with mental health and emotional well-being. Could we... Thank you very much. You're ahead of me, as usual. It says this: participants who had been experiencing poor mental health before the pandemic faced additional challenges with regard to managing the first lockdown, which were compounded if they were also struggling to make ends meet financially. Anxiety can exacerbate the difficult experiences thrown up by lockdown measures, including homeschooling, access to food shops, and reduced social and physical contact with friends and family, and can also have financial implications. For example, a mother's increased anxiety made queuing impossible, which stopped her being able to use her free school meal vouchers, as she did not know they could be used online. This meant that money for food bills had to come from elsewhere until the queues at her chosen supermarket had returned to normal. One father who struggled with anxiety and depression throughout the first lockdown described mental health problems as the second silent pandemic. Indeed, experience of lockdown had increased anxiety among some parents and children in this study who were already dealing with mental health issues that had been emotionally difficult for the whole family. Thank you very much. We can take that down. And that's just pausing and reflecting on the issue of family. That's something about which the inquiry has already heard evidence, that the pandemic and in particular the lockdown provision affected not only those who were suffering from poor mental health going into the pandemic, but also those with whom they had to share accommodation, their loved ones, family and friends, etc.
Yeah, that's exactly right. And I think that piece of evidence also shows how it will be, it have an individual effect. So how it sort of, the impact on your life will be very, very different from what you actually, what we're trying to do. So those people, worried about queuing or worried about sort of a certain element of their lives. And I think that's something that we see is that in the big statistics, you see sort of overall levels of harm, but almost you need to talk to individuals because it's that individual level of harm that the person's actually experiencing.
Yes.
And I think that's really important to bear in mind.
Thank you. In terms of impact of high poverty rates at the outset of the pandemic, you tell us that high poverty at the outset left people feeling exposed, which we've covered. In terms of access to key services and support, and in particular health and social care services, you tell us at paragraph 32 that many families in poverty reported that health and social care services became harder to reach during lockdowns, with postponed appointments, reduced face-to-face contact, which we've discussed, and long delays. adding to the stress and anxiety of households already facing challenging circumstances. And you note that families had to cope with missed medical checks, reduced support from social workers, and challenging in accessing GP appointments. And you recognise evidence from your grassroots poverty action group. What is that?
Yeah, so this is a group of about 10 people with lived experience that help advise us on various reports and give their experience and really kind of deepen our analysis to understand actually what's the lived experience of being in poverty. And it's really important to the Joseph Rowntree Foundation to hear those voices. And yeah, so they're a critical part of the organisation.
And they're providing you with their unique experiences.
That's right, exactly right.
And they told you that there were difficulties experienced by families faced in problems with accessing their usual support systems, such as informal childcare, which again the inquiry has heard about. You then go on at paragraph 34 to say that many reported that mental health support was also suspended or moved online. And you've already told us that digital exclusion meant that people in poverty were more likely to be left without an alternative.
That's exactly right.
Now, in terms of financial support, did the Joseph Rowntree Foundation have an involvement in the uplift of £20 a week that was made to the universal credit system?
So we talk about the adequacy of the benefit system, so we welcomed that increase and we thought it was an indication that the benefits at that point needed to be rising because lots of people would have been experiencing the benefit system for the first time.
Yes. And you say that accessing benefits is often complex and stressful. The systems can be confusing, and again, there's a stigma, some feel, to accessing support. And as you say, that was happening to some people and some families for the first time.
Yeah, so there was a massive spike in benefit claims at the start of the pandemic. So, but equally, we saw from that chart right at the start that poverty levels were high even going into the pandemic. So lots and lots of people were already on those benefits, and most of the people on particularly key out of work key benefits were in work. So it's not just an out of work issue.
Thank you. Let's look at a paragraph from the report of Professors Marmot and Bamborough, please, on the issue of savings. Thank you very much. Paragraph 105 of their report confirms that data from a survey of 8,000 adults by the Resolution Foundation and the Health Foundation point to an increase in inequalities in savings, while 32% of those on the lowest income quintile, which was less than £17,000 a year, experienced a decrease in their savings between February 2020 and June 2021. Only 10% of those in the highest income quintile did. That's those earning above £70,000. Conversely, 46% of those with the highest incomes increased their savings during this period, compared with only 12% on the lowest incomes. And lower income households were also more likely to experience an increase of 25% or more in their debt than those with higher incomes during the same period. And are those familiar figures and percentages to you?
They are, and particularly the conclusion that basically that almost like the more income you had to start with, the less severe the impact of the pandemic, you're more likely to actually increase your savings. Whereas if you're already low income with low savings, actually you were more likely to come out of the pandemic in a worse state. So I think that's sort of the thing I draw from that. And the other thing that one of our reports show is that if you've got low savings, there's a series of kind of health outcomes that are worse for you as well. So almost like the second thing you can draw from this is basically that you will also suffer like the health impacts as well from having no savings to start with.
Thank you. Can we take that down, please, and replace it with a section of the Housing and Homelessness Roundtable report, please, and look at other government interventions. It's at page 11, I think. Thank you very much. And this is going back to your evidence on universal credit. And we can see that government introduced other temporary policies during the pandemic, which aimed to support people in affording housing and providing greater financial security, including the £20 weekly increase of universal credit and the suspension of the benefit cap, limiting how much support one family could receive. Representatives at the round table felt that whilst these measures eased the financial strain of the pandemic for some households, they were temporary interventions that ceased once the pandemic ended, and as a result, people were left in the same financial position that they were in before the pandemic, or potentially worse off. And they also highlighted that the pandemic accelerated previous funding challenges faced by the sector. We can see a quote there from Mind, that homelessness initially decreased, which shows that bold intervention at pace is possible. But then afterwards, in my opinion, what we're seeing now is all the issues there were before have been exacerbated. It's like a pandemic-induced housing crisis now, with all the extra stuff that the pandemic caused. Is that a familiar issue for you?
Yeah, that's right. And that first chart, we saw that actually the poverty levels leapt back up to their pre-pandemic levels as soon as the support was removed. And I think also that support, that £20 a week, weekly increase, at various fiscal events for the government, there was a threat of it being removed. So we had to kind of campaign to extend it. So there was that uncertainty in people's minds as to whether or not they would see that income drop. Similarly with eviction bans, where there was a series of kind of points where would it stay, would it go? And I think that also will have caused a lot of stress for those people who are relying on those support mechanisms.
Because there is an impact on mental stress of the uncertainty.
That's right, exactly right.
And did you say that the Joseph Rowntree Foundation campaigned for both of those changes to remain and to proceed beyond the pandemic period?
That's right, and we do call for adequacy of the benefit system even to date with one of our campaigns.
Is it fair to say that one of the difficulties for families in poverty was that the support available during the pandemic only protected them during that time?
Yeah, that's right. And it's also the case that some groups were missed out. So people who were on legacy benefits, so universal credit is a new benefit. And one of the great things about it is digital, so it could be increased very quickly. But there are some benefits that it was superseding where that £20 uplift didn't apply. So one of the things we were calling for was, because particularly people with disabilities who might have been on the benefit system for a while are more likely to be on those legacy benefits, and they were missed out. And I think that as well as the uncertainty of how long it lasts, the thing we need to consider is the coverage of it as well, to try and plug those gaps and make sure not some of the most vulnerable groups aren't missing out.
Thank you. Food banks and community support next. At paragraph 38, you tell us that during the pandemic, reliance on food banks heavily increased, but even so, a recurring theme in your research was reports that local food banks were closed or were limiting assistance to only high-priority groups during lockdown. And what was the impact of that on the others that didn't qualify?
Yeah, so I think it's that kind of patchwork, and I think also it's the systems as well. So the food bank might be open, but the referral agency might be shut, or the other way might work. So I think that kind of thinking about, well, you need to get to the support, you need every stage to be open or at least accessible. And that's what we saw, is that it was a bit of a patchwork. So, but we did see the sector stepping up. So Trussell, one of the main food bank providers, saw a doubling of the people they were helping, despite all of the pandemic impacts, which is very, very bad, but also very good that they were able to actually scale up. But yeah, I think the thing we were worried about is that kind of local variation, and also thinking about, well, you need the referral and you need the food bank to be open, both of those things to be in place for it to work.
And in terms of what you describe as people stepping up, did you also receive information from interviewees that food banks were delivering parcels containing not only food but also other essentials.
Yeah, I think that's the other thing we saw is like some of the community support and things. Yeah, people trying to make a bad situation as good as possible through additional support, trying to work out how they would amend their services to try and plug those gaps.
Yes, the way in which you describe it at paragraph 41 is to say local charities, mutual aid groups and community organisations often stepped in where state services were thin.
Yes, that's right.
And that was obviously a very positive reaction. But access to that depended on geography and networks, so there wasn't an even coverage.
That's exactly right.
Yeah, thank you. Let's go back to the article Staying Afloat, please, and have a look at what are described as key points during the pandemic. So children spending a great deal of time at home increased households' consumption of food and energy, thereby hitting families with older and more children hardest. Free school meal vouchers played a crucial role in easing some of the pressure of increased food costs for families who were eligible, while children were home from school over the first lockdown, but also eased pressure during the school holidays. The cost of subscription for television or gaming could become a higher priority than previously when children were confined to the home. Rising costs in one area, such as food or electricity bills, could be balanced out by reduced costs in other areas, such as transport, leisure or extracurricular activities, but this depended on the extent of pre-pandemic spending in those areas, of course. While mortgage holidays or breaks in loan repayments helped during the first wave of the COVID-19 crisis, the unintended consequence might be to push these costs further into the future, potentially causing parents more worry for longer. There were concerns that bills could increase more dramatically during further lockdowns and in instances of children or parents spending more time at home, given the need for heating in the winter. Taking account of changes in outgoings as well as income is important to give a fuller picture of the impact of the pandemic on household finances. People with better income trajectories were more able to manage changes in costs, and changes in cost were more difficult for families that already had a low income and experienced both a decrease in income and an increase in costs. Even if incomes had not changed, if they were already low and outgoings increased, then that in itself caused hardship. And finally, lone parents were more likely to find covering increased costs harder given their solo income, particularly if this income dropped.
Yes.
Yes, thank you very much. Looking to the future and how best to support families on low incomes during the pandemic and beyond, did several parents to whom you spoke draw on the usefulness of vouchers, and did they tell you how important those had been in lessening or controlling the impact of the pandemic?
Yes, they did, yes.
Yeah. We've discussed changes to service delivery and support, noting the shift to digital provision of services and that patchwork provision of services, which you've already made reference to. We've also touched upon the impact of pandemic measures and guidance, stay-at-home orders, social distancing, and support bubbles as well, which people followed and were designed to ease isolation, but in fact meant that people couldn't access the support of their families often.
Yeah, I think that, just the variations in people's like family structures, locations where they support, and I think also for low-income families that support can be really critical. So if you are far away or can't visit those people you rely on, it can be very traumatising. Yes.
Thank you. The impact on key workers in poverty. The inquiry has heard that those frontline workers experienced an increased risk of infection. And at paragraph 66, you say that the UK Poverty Report, which you produced in 2020-2021, noted that low-paid, insecure workers were disproportionately carrying out those roles, those frontline roles. Is that right?
That's correct, yes.
Such as care, provision, cleaning, transport and retail, where exposure to COVID-19 was at its highest. In your work, you say at paragraph 67, and work from the Resolution Foundation, it looked at how to protect firms and families from the economic impact of coronavirus, but also looked at the loss of income and the lack of public health advice aimed at protecting people. So was it the case that for those who were often carrying out key worker roles, the message to them about what they should do to protect themselves and to protect those to whom they were going home at the end of a shift or a day was confusing and often not translated into languages which they would understand?
Yeah, I think that's correct. And I think also just the kind of impossible choices you might face in those circumstances about, you know, particularly you might need the income from the work, and it's it's that kind of double whammy of, particularly with the statutory sick pay being very low.
Yes.
Sort of you're almost in an impossible situation of having to think about going to work when you're not well, just to make sure you bring in some income.
Right. So a difficulty in understanding the messaging from the government, and then an impossible decision to make often as to whether or not to carry on working.
Yeah, that's right.
Thank you. What is the single most significant change which could protect these workers in a future pandemic?
Yeah, so I think some of the furlough scheme was really, you know, a critical thing to protect workers and stop a massive spike in unemployment. But I think there was very many gaps in the provision there in terms of like its speed of access, in terms of people who are missing out from that. So I think something like that would be needed, but also to make sure it lasts long enough to, you know, that again, that kind of piecemeal support that can be withdrawn at any point, having that, you know, unwinding gradually and making sure it's got a widest coverage as possible would be what I would suggest.
Thank you. I think we've covered this, but is there anything else that you would like to say about the impacts of poor housing and homelessness during the pandemic?
Only that, as I say, I think it's almost at all dimensions. It sort of exacerbates existing worse situations. So you'd be stuck at home, perhaps in a crowded accommodation, so the higher rates of infection likely. Also harder to access kind of maintenance and things like that. So the accommodation might also be deteriorating, harder to get out, and you know, if you haven't got a garden and things like that. So I think the kind of disadvantages kind of accumulate. So I think that's what I would emphasise.
Thank you. Towards the end of your statement, you tell us about the impact on specific groups experiencing poverty, and those include the following: race and ethnicity, disability and long-term health conditions, gender, age, and migrants and asylum seekers. I'm not going to take you to the detail because the inquiry has heard from a series of experts dealing with each of those, but your basic conclusion is that people experiencing poverty was across all of those categories.
Yes, that's right.
Thank you. And so finally, may I ask you please to look at the lessons learned section, and let's display how you deal with this in your witness statement. Thank you. The first thing that you tell us at paragraph 130 is having a good, secure, safe job that can be done remotely, living in a spacious, comfortable home, having strong social support networks, being digitally connected and being in good health resulted in a different experience of the pandemic compared to people who didn't have those things. And those insights need to be built into policy design going forwards. You then discuss the shift to online provision of services. You say it wasn't new, but a continuation of a trend that was already underway, and that it worked well for many people, but excluded others. And we've discussed that. Moving on, you tell us about your collaboration with the Children's Society, the Lloyds Bank Foundation, and Turn to Us, working with organisations providing emergency responses at a community level, found that part of the challenge was the sudden inability to operate their face-to-face services, which we've already touched upon. And finally, at paragraph 133, you say this: they spoke about how the move to remote support made it difficult to provide the type of services that clients need. For example, food banks shared that they could provide food parcels, but not the holistic support they usually offered in relation to mental health and debt. Similarly, welfare rights organisations shared that they found it hard to support people with complex personal circumstances as they couldn't meet in person to look into problems and contact DWP together, and that this was compounded by trying to shift their services online whilst also experiencing a spike in demand. This points to the need to consider resilience and contingency planning, not only in the public sector, but also among community providers. Yes. And are those the lessons learned and recommendations that you and your organisation would make going forward?
Yes, I think so. I think just to broaden slightly, if I may. So yes. I think there's sort of 4 kind of key policy areas. So one is strengthening social security, which I think is really important. Then it's on the housing support side of things. Then on labour market support, and then community responses. But I think that first paragraph about the intersectionalities and how, you know, somebody in that almost ideal situation of having everything going for yourself is a totally different experience to somebody who's, you know, saying no to all of those categories, which quite often people would be, because, you know, if you're in one of those negative categories, you're more likely to be in more. So I think almost having, not having that as your typical person, but having somebody who's struggling with those areas as your typical person would be really helpful in designing effective policies in those areas.
Thank you very much. My lady, that concludes my questions. You have provided permission for Migrants' Rights Consortium to ask one question, and I think, again, that's going to be asked by Ms Iqbal.
Thank you. Yes, Ms Iqbal.
Thank you. Mr Matichek, at paragraph 108 of your witness statement, you set out the ways in which migrants were disadvantaged during the pandemic. That is at page 28, if you'd like to have a look. Thank you. Do you agree that during the pandemic there were specific factors, for example, targeted immigration law and policy, excluding migrants from mainstream welfare and creating barriers to accessing healthcare, which affected vulnerable migrant groups and were distinct from the impact on ethnic minorities generally?
Yes, I do agree with that. And I think some of those things, or most of those things, would have been existing either side of the pandemic and still exist. So yes, that's correct.
Thank you. I'm grateful, my lady.
Thank you very much indeed, Ms Iqbal. Sorry, I hadn't unmuted myself. That completes our questions for you, Mr Matichek. Thank you so much for your help and for the Foundation agreeing to assist the inquiry. It's all been extremely helpful and interesting. Thank you.
Thank you.
I think we've got slight problems with witnesses. Somebody's flight was cancelled this morning.
I'm afraid so, yes. We're making provision for that person to be able to give their evidence remotely, my lady. We've made good progress this morning.
We have.
I wonder if I could invite you to rise and to sit again at 1:30.
Certainly, and let's hope it works with remote technology for the witness. If it doesn't, I'm afraid we're going to have to go ahead.
Yes, understood. Thank you, my lady.
Thank you. I shall resume at 1:30.